On the Health Beat this morning, new guidelines suggesting that children struggling with obesity should be evaluated and treated early and aggressively. The American Academy of Pediatrics says treatments can include medication for kids as young as 12 and surgery for those as young as 13. The group said today delaying treatment to see whether children and teens outgrow or overcome obesity only makes things worse. Joining us live with more on this is Dr. Yvonne Friday, a pediatrician at Children's Hospital of Michigan. Dr. Friday, thank you for joining us.
Thank you for having me.
Okay, so do you agree with the new guidelines? What are they, if you could, just sum them up, and then do you agree with them?
What we're seeing here is an explosion of information regarding the lifelong risk assessment of cardiovascular, atherosclerotic, and cardiovascular disease in children. What the AAP is trying to get us to do is to stop relegating an elevated blood pressure, an elevated hemoglobin A1C, which we use to kind of let us know how the body is handling glucose, not relegating the BMI percentiles that are getting elevated to the back door. They want us to notice these changes, to talk about diet, to talk about activity, because we are now learning that all of those things can impact a lot of immune diseases, endocrine diseases, children who have cancer. All of those things are integrating together to say this child is at risk for atherosclerotic disease. What I are now trying to do is to determine what are the factors that will give us the best indication that we need to do surgery for your child now. We may need to start metformin now. They are putting together some multi-center studies to look at what happens if I use this drug, what happens if I do activity, what happens if I change diet, so that they can pull that data back together and tell us definitively what should we do. But right now, can we please at least look at the numbers and don't relegate that child to a wait and see. We need to see that child regularly, assess not just the child, but family members, and look to see what other diseases are in that family that are telling us that this child has a heightened risk assessment and we need to do something now.
Why do you think that we're seeing such an epidemic? I know that it was a rising problem even prior to the pandemic, but we're seeing it's even worse now. In your experience, why do you think that children are really dealing with these issues right now?
I think we are doing the AAP is doing a much better job of telling us this is what you need to do. So initially, they had put down recommended things to do at certain ages. They changed that about 5 years ago to say every child must be evaluated for atherosclerotic risk between 9 and 11. Let puberty happen, but then go back before they go into the adult world and do that again. So they made that change a few years ago that said, you don't ask questions about who gets to be assessed. You assess everyone. That's number one. Number two, we recognized during the pandemic, unfortunately, we realized that having kids locked up in buildings was not helping things, that activity was important, that them staring at these little screens, which we already knew before the pandemic, staring at screens all day was not a good way to get health, but that it happening even more during the pandemic when they were not able to go to school, that was a factor. We had kids that weren't going to see their doctors. They're now coming back in droves. And as the AAP put down, you must assess, not just you should assess. These are your guidelines for assessing. We are just picking up many more kids, and they're asking us not to relegate them to just minor things. You've got to keep track of these kids.
And in terms of, do you agree with what they're talking about in the methodology, kids as young as 12 for medication and as young as 13 for surgery?
They have actually been talking about this over the last 3 to 4 years. I have not had a chance to go back and look at the case studies yet, but they have been bringing that up to us over the last 3 years. So once I go back and look at what they use to say this, I'll be able to come back and tell you whether or not I agree at that point.
And just in terms of recommendations, if somebody's listening right now, they should get their kids to the doctor. They should have their annual physicals at the very least, correct?
Yeah, Yeah, and you know what? The other thing is we're supposed to do those BMI percentiles at every visit, and they're asking us to not just go in there and not notice a percentile, not notice if there's been an increase of 4 units, not notice. Remember, we just got new BMI growth charts that tell us what is the difference between 95th percentile, 97th percentile, 99th percentile, 99 point now. They're giving us all of this information to say, do not relegate to the back door. You must look at your patient, their family, and their risk and come up with a plan.
All right, Dr. Yvonne Friday, a pediatrician at Children's Hospital of Michigan, thank you for your time this morning.